Hi, I'm Don McGann, as most of you know, some of you don't, but I'm the crazy guy that started all this years and years ago. And I've been working nonstop for the last 4 or 5 years with the company I've been asked to talk about. I've been asked to talk about their technicians at a new company like Progressive Aligners. And as you already know, we are partnering up with that so that we can create the best product for you. Well, to get the best product, you have to go through a technician, a designer. Well, who is that? I don't know. I've never seen one. It's just a mystery person on the other end that you send some of my instructions to and some STL files and say, would you please set up the teeth for my patient that's going to make them happy and make me happy? And please follow these instructions. Now, if you don't send them instructions, some of you think that they're just going to magically be able to take this piece of digital wax, like a little wax up. They can't see where the bone is. They can't see where the lips are, except they do have you send some photos, I suppose. But that's quite challenging for a non-dentist, right? This is just a technician that has been trained for, I don't know, I get rumors about maybe just a couple of weeks in some of the leading companies and 4 months or more, and the one that we're going to be using, but I don't know. I don't know who's there, if it's an experienced one that has done thousands of cases or the first one. This might be their first case. I don't know. I can't select them. I can't say, I want Charlie. No, you get whoever's there. And in fact, you are probably getting a different technician every time you submit the case for some correction. So the issue is, do they understand what our instructions are? Do they understand how teeth move? Do they understand what is a nice smile? Do they understand that like canines are supposed to be longer than lateral incisors? Okay? Do you understand the problem here? Okay, so we do it. We send in, as a mentor of a trusting doctor, we send in their case with a list of instructions, and we say, please do it this way. And then they send it back to us, and we go, okay, I don't like this, but I do like that. Now, once in a while, at this particular company, now I'll call it Progressive Aligners, you're going to get a few of the cases, I don't know what the percentage is, I haven't counted them, that are good on the first setup. Okay, great, wonderful. I kind of look at that case skeptically and say, there's got to be something wrong here. So I'm going through looking at the rotations, looking at the angulations, looking at how it bites, looking about something. You got to find something. Otherwise, I'm not doing my job. So, but there are cases where we say, yes, that's good. But the rest of them, we have to then evaluate the case, read the instructions we get, see which ones they did, which ones they didn't, see ourselves whether or not we didn't write it down right, make some modifications in the form of instructions, and try it again. We call that back and forth. And when it comes back, you have to open up the case again because you forgot. I mean, I have lots of cases going through my head through my consulting practice. Yes, I'm in practice. I don't go to the office. I sit in my own little office at home, but I'm in practice. I'm looking at all these cases worldwide and giving advice on how they're going to look the best. Okay, so I have to review the case. This is on the back and forth. This is back again. Review the case. Well, first of all, I got to find the file. I got to read what the notes were from a technician. Go through my instructions. See if they were all done. Figure out if there's anything I want changed. Does that take time? Yeah, probably 20, 30 minutes. By the time you write your other instructions, your revised instructions, say, okay, try it again. goes off, does it go to the same technician? I don't know. It doesn't say, by Charlie. It doesn't say. So I don't know. But I know at some places you may get the same technician. Other places you're going to get somebody entirely different. And sometimes that's fortunate because maybe the first one came out really bad. So what is a good technician? Why do I say that this company has the best technicians for you? Well, first of all, their best technicians are not assigned to just the orthodontist that sends them 1,000 cases a year. No, you're obviously getting some of their best technicians setting these up. Otherwise, what are they coming back so good for? Okay? They have to be better trained, better quality assigned to your case. Okay? Otherwise, I wouldn't see those kinds of results. And they know what I'm talking about. They know how teeth move. They know what the end point should look like. They know how much overjet there should be, even though I write down, I want 2 millimeters overjet and 2 millimeters overbite. Well, they got to understand what those are. Otherwise, it comes back at random, It isn't even what I asked for. So that's why I think they are the best technicians. That's why I endorse this, and I'm so thrilled to have this company to be doing your cases because it makes my job easier, especially when you ask me to consult with you. Don McGann. Keep them coming.